Welcome to Pharmtoberfest, which celebrates American Pharmacist Month. We are interviewing pharmacists who play different roles in the health of our communities. Today we have Dr. Michelle McElhannon, who is an ambulatory care pharmacist and works with a predominantly diabetic population. Welcome, Dr. McElhannon.
Thank you.
Why do you think it is important to celebrate American Pharmacist Month?
American Pharmacist Month gives us a great opportunity to share all the many roles that pharmacy plays in keeping patients safe and making sure that medications are working as they should be. I think a lot of times most people only have exposure to their community pharmacist who they maybe only see checking tablets in a bottle or behind the computer and not really see all the steps that go into making sure those tablets that are going into that bottle are safe for you and also keep working as they should be. But there's also a lot of other types of pharmacists that people don't know about as well, and that gives us a great opportunity to share that with you.
How does pharmacist intervention and education improve outcomes of patients with diabetes?
In my clinic, I teach diabetes self-management, education, and support. So what that means is I teach patients how to alter their lifestyles or teach them all the information and resources they need so that their diabetes improves. And of course, we're going to take medication very seriously in those situations, and we're going to look at all the medications, make sure there's no drug interactions, make sure there's no conflicts with their disease state. But we're going to teach the patient about things that can work together with the medication to lower their blood sugars. And it really works. In our clinic, we have lowered blood sugars successfully and improved outcomes for our patients.
Wonderful. So in terms of diabetes, how can pharmacists help the community?
Well, there's over 30 million people in America with diabetes, and diabetes remains the leading causes of blindness, kidney damage, as well as amputations. So these little steps we take to improve patients' lives through education that we provide and through the support that we provide and decrease those blood sugars will decrease those complications. There's so many different pharmacists that work together with your doctors, your dentist, your nurses. So we're used to coordinating care. So we have a lot of resources that we can pull together to improve diabetes overall in the community.
Thank you so much for joining us.
Thank you.
Thank you, Dr. McElhannon. Hey guys, my name's Amelia Gay. I am a P2 who is one of the co-chairs for Operation Diabetes. So today I'm going to talk to you a little bit about type 2 diabetes. Type 2 diabetes is the inability to control sugar levels in your body using insulin the wrong way. It is the leading cause of stroke, blindness, and lower limb amputation, with about 30 million people in the U.S. having type 2 diabetes and about 7.2 million of those being undiagnosed. That is approximately 9.5% of the total U.S. population having type 2 diabetes. And approximately 79,500 deaths annually in the U.S. are from diabetes. But a healthy lifestyle does prevent about 80% of the cases. And some common symptoms you might see with type 2 diabetes are frequent urination, feeling very thirsty or extremely fatigued, blurry vision, or the inability to explain weight loss, so some unexplained weight loss.
Hey guys, this is Jonah. I know y'all just heard from Amelia, so I just want to hop on here and go over a few quick facts with you about diabetes. One of the biggest questions people have is it caused from eating sugar? That's actually not true. Type 2 diabetes are caused by a lot of environmental factors and some genetic factors. If you go to diabetes.org, it's a great resource with a lot of general information about diabetes. And they also have this cool tool called the risk factor quiz that you can do. It kind of goes over some of ththose factors with you. So it'll ask you about your age, your weight category, if you have a family history of diabetes, and then it'll ask you about like high blood pressure and your activity level. But one of the main things that you can do to decrease your risk is just promote a healthy lifestyle. So just making minor diet changes and increasing your activity level can go a long way. So like I said, diabetes.org is a great resource. And if you have any questions, you can reach out to us or anybody else on exec. And then also for this video, our secret word is going to be risk assessment. So thank you and go dogs.